proceed to check patient electronic health record, check for orders to do head, eyes, ears, nose, and throat assessment. I check for patient allergies, I check patient demographics, health history, and I close the computer for compliance. Proceed to perform hand hygiene by washing hands with soap and water. Proceed to knocking on door.
Hello?
Hello, good morning. I'm your student nurse, Jonathan. Can I, let me proceed to close the curtain for patient privacy. Proceed to perform hand hygiene. Can I verify your patient ID band, please? Verifies patient name, date of birth, and medical record number. Can you please tell me your full name and date of birth?
Jordan Zimmer, 12/22/97.
Okay. Proceeds to verify that medical record number matches patient health record. Do you have any food allergies, Jordan, or allergies to medication or environment?
No.
Proceeds to verify with medical record. Closes computer for HIPAA compliance. Hands again for hand hygiene. Okay, Jordan, I'm gonna ask you a few questions before we begin. First, where are you?
I'm in the Osceola Hospital.
Okay. What date and more or less what time of day are we in?
It's October 7th, 2022, and it's like 12 in the afternoon.
Okay, excellent. So I'm going to do a head, ears, eyes, nose, and throat assessment on you. Is that okay? On a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, do you have any pain within that range?
No, I'm at 0.
Okay, excellent. Are you comfortable in the position that you're in right now?
Mm-hmm.
Okay, excellent. So I proceed to inspecting the patient's head and skull. Head is round, symmetric, no visible lesions or masses, no deformities. Proceeds to inspect or palpate the hair and skull. Okay. Palpating the scalp for mobility. No visible lesions or masses. No parasites. Hair is smooth. Quality is adequate. Distribution is adequate. Proceeds to removing gloves, performing hand hygiene. Next, I proceed to inspecting the face. There is no edema, no deformities. Face is adequate, skin color is adequate. Symmetry. Next, I proceed to inspecting the eyes externally. Eyes are aligned. Eyebrows are aligned and hair growth is adequate. Eyelashes are symmetric. Hair growth is adequate. No visible ptosis. Now I proceed to inspecting the internal aspect of the eyes. Okay, Jordan, I'm just gonna pull down your bottom eyelid to check your conjunctiva and sclera. Conjunctiva is pink and moist, and sclera is white, no discoloration. I'm going to proceed to checking your pupils and iris and cornea. Cornea is smooth, clear. Pupils are round. Iris has adequate coloration and is even. Okay. No cloudiness on cornea. I'm going to proceed now to check to test your pupils for reaction to light and accommodation. pupil size has decreased. Both pupils have decreased. Okay, pupils are equal, round, reacting to light. I'm going to test accommodation. Follow my finger. Pupils are reactant to accommodation. Okay, I'm going to proceed to inspect your nose. No lesions, no deformities. The nose is midline. I'm going to proceed to palpate your sinuses. Do you feel any pain?
No.
These are frontal sinuses, palpating maxillary sinuses.
No.
No pain? Okay, excellent. Removing gloves, performing hand hygiene. Okay, and just let me inspect to make sure that there's no nose bleeding, no epistasis. No visible lesions or epistasis. And septum is adequate, midline. Okay, I'm going to proceed to checking your ears. No visible lesions, size is adequate. Let me proceed to inspecting your ear canal. No excessive cerumen. Do you wear a hearing aid?
No.
No discharge. Okay, I'm going to proceed to palpating your ears. I'm going to pull on your pinna. Let me know if you feel any pain. Pain?
No.
Any pain?
No.
Any pain?
No.
Okay. Removing gloves. Performing hand hygiene. Okay. Now I'm going to proceed to assessing your mouth and throat. Externally, mouth is adequate, no lesions, no visible abnormalities. Can you please open your mouth for me? Mucosa is pink, moist. Stick out your tongue, please. No lesions on tongue. Uvula is midline, and tonsils are +1 present. You can close your mouth. Actually, I'm going to proceed to palpating your maxillary temporal joint, obtaining additional gloves. Okay, Jordan, when I say just open and close your mouth, I'm gonna palpate. Okay, close. Okay, there is a pop present on maxillary temporal joint, temporomandibular joint. Okay, so now I'm going to proceed to inspect your throat and your lymph nodes. Is that okay? Okay, so inspecting throat for no lesions, no visible masses. Oh, and let me proceed to inspecting your teeth. Teeth are white, all teeth present. No cavities. Okay, so let me proceed to inspecting your neck and throat. Okay, palpating submental lymph nodes, no inflammation. submandibular lymph nodes, pre-auricular lymph nodes, post-auricular lymph nodes, occipital lymph nodes, posterior cervical lymph nodes, anterior cervical lymph nodes. Can you turn your head slightly to the right for me? Palpating thyroid, no swelling. Thyroid size is adequate. Okay. Removing gloves, performing hand hygiene. Okay, so we are all done with your assessment on a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible. Do you have any pain within that range?
0.
0. Do you have any questions for me?
No.
Excellent. Let me give you your call light. If you have any questions, you can, or you need anything, you can call for me. I'll be checking up on you in the next 30 minutes or so.
Okay, thank you.
Okay. Documents findings and closes computer for HEPA compliance.